If you're pregnant and trying to stay active, but you're not sure what's safe, what to avoid, or what actually supports your body right now, you're in the right place. Exercise during pregnancy can be incredibly beneficial, but not all movement is safe for every stage. Hi, I'm Dr. Jessica Babich. I'm a doctor of physical therapy in New York City, specializing in pelvic health, orthopedics, and holistic head-to-toe care. Today, I'm breaking down the exercises to avoid during pregnancy, why they matter, and what is safe and supportive as your body changes. Let's get into it. The American College of Obstetricians and Gynecologists recommend avoiding exercises that increase the risk of abdominal trauma, overheating, or loss of balance. As pregnancy progresses, your center of gravity changes. Your balance becomes less predictable, and your joints become more mobile due to hormonal changes. Activities with higher risk of falls or direct abdominal impact include contact sports, horseback riding, downhill skiing, and gymnastics. Even if these were easy before pregnancy, the combination of changing posture, balance, and muscle patterns increases the risk of injury to you and the baby. Joint laxity is also an issue in pregnancy. During pregnancy, the body releases relaxin, a hormone that softens connective tissue and prepares the pelvis for birth. But relaxin isn't acting alone. Estrogen and progesterone also change tissue elasticity, increases vascularity, and shifts how muscles and ligaments support the pelvis, hips, and the low back. So it's not just that your ligaments are looser, your entire support system is recalibrating. At the same time, your center of gravity shifts forward, your abdominal mass increases, and your muscle recruitment patterns change to support the pregnancy. This is why your hips, knees, feet, and the low back may feel vulnerable. And it's also why high impact or jerky movements, quick twist, and sudden direction changes should be modified or avoided. The good news when it comes to exercise, intentional movement, strength training, and breathing mechanics improves your stability even as your hormones shift and your body changes mechanically, posturally, and neurologically. The next activity to avoid does not apply to everyone, but it's worth mentioning. Scuba diving is not recommended during pregnancy. Rapid pressure changes underwater can cause gas bubbles to enter the bloodstream. An adult body can filter these, but a fetus cannot, which increases the likelihood of fetal decompression sickness and developmental complications. Other exercises to avoid are those where overheating can become a problem. We want to avoid any activity that raises your internal temperature too much. This includes hot yoga, hot Pilates, and prolonged workouts in high heat or humidity. Elevated core temperature and dehydration can reduce blood flow to the baby, increase heart strain, and may trigger uterine contractions. So make sure that you stay hydrated, pace your workouts, and keep your environment cool. That's all essential. So what are some warning signs to stop exercising in pregnancy? Now, there are times you should stop exercising and call your provider. You want to stop exercising and seek medical attention if you experience any vaginal bleeding or abdominal or chest pain. Anytime you're feeling dizziness, fainting, shortness of breath, or even breathlessness before activity, if you have a severe headache, any sort of painful contractions, or you're leaking amniotic fluid. We also want to stop exercise if there's swelling or calf pain, as this could be a possible blood clot. You also want to stop for sudden muscle weakness or changes in balance. So what are safe exercises in pregnancy? For most women with healthy pregnancies, moderate exercise is safe, beneficial, and strongly encouraged. Safe and low-risk options include walking, prenatal yoga or Pilates, gentle strength training, and low-impact cardio. As a doctor of physical therapy who specializes in women's health, I also recommend using a stability ball. I have several videos on my channel on how to use a pregnancy ball in the first trimester, second trimester, and third trimester. So be sure to check those out. And here's the nuance most people don't get. If you are exercising before pregnancy, you can often continue many of those same activities, as long as they feel good and you make smart modifications. The goal in pregnancy isn't to stop moving. The goal is to move with intention. So things we want to avoid, again, are extreme heat, anything that causes pain, breath holding or straining. We also want to avoid exercises that create excessive downward pressure on the pelvic floor or through the abdominal wall. The simple rule is listen to your body, and move in ways that feel good, safe, and supported. During pregnancy, how you move matters more than how hard you move. Take planks, for example. They're not inherently dangerous, but as the abdominal wall stretches in pregnancy, a full plank can actually increase the intra-abdominal pressure and contribute to coning. A smarter option might be a hands and knees core work, where you're still doing deep core activation without overloading the linea alba. The same principle applies to other high impact moves, such as instead of box jumps, go for a supported step up, or instead of dropping to the floor for burpees, maybe do an incline burpee or a wall burpee. Or instead of any sort of high impact jumping, modify that with marches, sled pushes, or weighted carries. These activities still challenge strength and power without the heavy landing forces or pressure spikes. You're not avoiding strength. You're just choosing movements that support your core and your pelvic floor and your overall stability. Because the goal of exercise in pregnancy is not to tighten, shrink, or just push through. It's to support circulation, your posture, your core control, your pelvic health, and your nervous system regulation, so that your body feels strong, stable, and supported as it changes. Strength training can be especially beneficial when breath and pressure management are in place. The key is listening to your body, modifying when needed, and never pushing through pain, dizziness, or exhaustion. If you have a medical or obstetric complication, check with your provider. Some women need a personalized plan. With thoughtful adjustments, exercise can be one of the most empowering parts of pregnancy. If you found this helpful, let me know in the comments what questions you have about exercise during pregnancy, and I'll be sure to answer them in future videos. Hit like and subscribe for more evidence-based pregnancy, postpartum, and pelvic health education. I'm Dr. Jessica, and I'll see you in the next video.